This is a podcast about the psychology of fear in the COVID-19 crisis. The COVID-19 crisis, which has originated from Wuhan, China, has been such an unprecedented global event that made the entire world overwhelmed. The COVID-19 has recorded almost 8 million cases without those who are recovered, around 420,000 people of deaths as of today, June 11th. Due to the trait of an epidemic that spreads especially by people's saliva, the COVID-19 shows a high consequence of not paying attention to the importance of early treatment, of implementing several policies such as self-quarantine, social distancing, and lockdowns. Despite a few countries having been confident that they didn't have any COVID patients until February, many countries around the world has COVID patients now and are affected by COVID in the same excruciating way. The economic and psychological consequences of the COVID-19 pandemic have been far-reaching. However, even if economic and psychological loss is happening all around the world and with different degrees depending on individuals, the emotion of fear is what universally is common regarding this unfortunate COVID-19 crisis. According to the fear of COVID-19 scale devised by a research, a number of people, regardless of their classes, are highly concerned about this pandemic issue. The international era has also contributed to the spread of the already universal emotional trait of fear, due to simpleness of transportation using airplanes, ships, and etc. from a country to another country. The fact that the disease that affects one's lung and makes it unrecoverable to the previous state that they might also die contributes to the extreme fear of the disease. COVID-19 is fatal, especially to those with underlying diseases and those who are elderly, such as diabetes and cardiovascular diseases. Given the severity of the disease puts the vulnerable into a significant risk. This makes the family of those people also go paranoid, as indicated by the research from the Journal of Concurrent Disorders. According to the journal, 56% of 808 online poll participants were concerned or very concerned about the COVID-19 disease. A Canadian research among 1,354 adults showed more concern of their citizens, which showed that nearly one-third of the participants were worried about COVID-19. Being worried about the pandemic is not wrong, but definitely normal. If we look into the facets of people's fear regarding COVID-19, it is the fear of uncertainty. There are many types of phobia in the world, but the journal posts that there can also be the phobia for diagnosis, especially to a disease. Along with the fear appeals from the mass media and lack of communication and timely response from each government, many individuals are shivering in fear these days in one mind. Diagnosis itself has a negative connotation, and if they are diagnosed with the disease, they are fearful about the stigmatization and afraid of being abandoned or separated even from their loved ones. The journal is defining fear as it includes both risk perception and emotive elements such as fear and worry. However, many examples are showing that emotional elements are bigger, as it also contributes to paranoid state of an individual, shown by suicide of people who committed suicide thinking that they caught COVID-19 when they hadn't. The fact that many people are so paranoid over infecting their loved ones and other people's perception of them when they caught COVID is also shown in doctors' responses of fear as well. Many doctors as well as health officials have been showing fear during this crisis, mostly because of their possibility of infecting their family members and loved ones. Even though a number of doctors and nurses in the hospital do not get directly involved with the disease, they are highly exposed to the virus due to their working environment. A research conducted by Pakistan Journal of Medical Sciences on Pakistani, US, and UK doctors showed that the fears of doctors is followed from the top reason of infecting family members, as 80% of them chose this one, rapid spread of disease by 63%, complications of disease 60.3%, becoming a carrier and missing the diagnosis followed by them. The late declaration of WHO regarding COVID-19 pandemic and the lack of definitive cure and foreseeable future, as well as the fact that they are fighting a disease that they do not even know what it is, epidemiologically exactly, made their fight more tiring and exhausting. The fact that young and healthy people can also die from COVID due to a phenomenon called cytokine storm of one's immune system attacking itself and killing the person also makes the entire pandemic situation more hopeless. Overall, COVID-19 is a highly devastating and is posing a dire situation to the entire humanity. Many people, including honorable doctors and nurses, are fighting for COVID in the front lines, but normal people are also fighting on their own. There are substantial global economic laws contributing to the paranoia regarding this pandemic, but psychological ones would be bigger in doing that in tandem with economic factors. Along with social stigmatization and losing connections with their loved ones, also are the factors that lead to the extreme paranoia, since we humans are social beings. I think in that regard, COVID-19 has given us the lesson that we are all together and all the same humans, regardless of where we are from, what we do, and how old we are, and feeling fearful and fear. Thank you for listening to this podcast.